Good morning, everybody. It's 10:30 a.m. So let me go ahead and get started. I want to welcome you all to the Global Center for Siddha Medicine and Research, um, our webinar series. We have been holding a number of webinars, and just a quick bookkeeping thing. If people who are not um, speaking, please mute your phone or your speakers, so there is no disturbance when the presenters are doing their presentation. And we have been holding a number of seminars. I think this is the 10th or 11th webinar that we have been holding. Let me do a quick PowerPoint presentation on what GCSMR is. So Global Center for Siddha Medicine Research is it's a pretty new organization. We started about a year and a half ago, and the main reason why we started this organization is to spread Siddha knowledge worldwide, and it's got members from both India and the US, and Siddha is something that's very ancient, and it's known only within South India and mostly within Tamil Nadu and then Kerala. So our main goal was also it's an ancient knowledge, like a traditional medicine system, but it has got some scientific background to it. How I think it was developed over 5,000 years, with basically based on um, people who added to it are known as siddhas, and but GCSMR was basically started to do research, science-based research on the efficacy of promising Siddha drugs. And as part of that, we have signed a MOU with Manipal University in Karnataka, India, to do an integrative approach of working with allopathy medicine and Siddha medicine, and then do clinical studies, and then present the results in science journal as well as medical journals. And there are a number of other things. I'll just quickly read over the mission. Siddha knowledge worldwide, as I said, health related. We also have been doing integrative webinars where we bring a Siddha doctor as well as modern medicine practitioners to give their perspective on different health related problems that the general community faces. We also do health coaching and consultation. And we are working on trying to introduce Siddha medicine into modern medicine curriculum. As part of that, actually, we have been working with Morehouse State in Atlanta to develop some, it's like elective for allopathy doctors when they're doing their MD. Again, as I said, 2021 plans was the establishment of Integrative Center at Manipal, and our funding needs are high, but it's about $300,000. And people who sponsor are always welcome, and there are some benefits that you get out of sponsoring that. That's pretty much it. But today's program, I'll introduce Dr. Sankari Sivasailam, my wife, and she's the one who got me introduced into Siddha medicine as well as into this GCSMR. And let me turn it over to her, and she's going to introduce about today's program as well as the speakers. Go ahead, take over.
Vanakkam. Good morning to everyone. And we have two great speakers for a great topic, which is very apt for the current pandemic. So just to keep up the time, I'll proceed with introducing the speakers. The topic for today is coping with pandemic stress, integrative strategies. And I'm extremely honored, and it's a great pleasure to introduce the next generation, the second generation of healthcare professionals and physicians. And today we have a great speaker, Selvi Chellaiah. And I have to say this, Selvi, I mean, she's a daughter of Dr. Selvi Chellaiah, one of community leaders in Maryland. And Selvi has had her Bachelor's of Arts in English Literature. Then she did her Bachelor's of Arts in Psychology and Master of Science in Clinical Mental Health Counseling at Johns Hopkins University in Baltimore. I have seen Selvi as part of our community in the last 15, 20 years. She's a very compassionate, caring person. She feels so comfortable to interacting with all the aunties in the community, always willing to help and give a great perspective of, you know, our generation. I feel like she's the bridging gap of the next generation and the older generation. And you know, she's been a program supervisor, Empowering Mind Resource Center in Baltimore in 2018. Then she was a crisis counselor for Grassroots Crisis Intervention Center, Columbia, Maryland, from 2018 to present. She's a licensed clinical mental health therapist, and she's very skilled, compassionate, and very dedicated with her job. And any questions I have, even when I'm being a medical oncologist, she's so easily accessible. I can text her and she will respond right away, and takes extra time to respond right away. And she's highly experienced in family therapy, group therapy, and she has her own practice, and I can go on and on. So I felt that when we chose this topic, she's the right person to talk. And without taking much time, I'm going to, it's a great pleasure and to welcome Selvi, and the stage is yours, Selvi.
Thank you so much, Auntie. Of course, the day that I am speaking, I'm having a little bit of voice problems. You have to bear with me, but I would like to say thank you to Auntie and for the organizers for asking me to speak today. I'm very honored to be here. It's also really good to see Dr. Selva again. So thank you all for having me. I'm going to share my screen and start the PowerPoint. Okay, please let me know when you can see the PowerPoint.
We can see it.
Okay, I'm going to make it bigger. Okay, there it goes. So we are talking about coping with pandemic-related stress. While I go through this, I would like everyone to sort of ask themselves some of these self-reflection questions. When I'm in therapy, I want people to develop some insight into what they are coping with, what they are dealing with. So what pandemic stress are you coping with? And how has this affected your mental health? And also some of the questions that I want you to get some insight on and shed some light on is, when should you seek help from a mental health professional? And what are some integrative coping practices to help you manage stress? So let's talk really quickly about what stress is. This information is from the American Psychological Association. Stress is very normal. Everyone experiences stress. There can be good stress and bad stress.
Dr. Prabhakaran, can you please mute? Dr. Prabhakaran, can you please mute?
I don't think they can hear us, Auntie.
Okay, I'll put the chat. I'll do the chatting.
Yeah, you go ahead, Selvi.
Okay, so some of the pandemic-related stressors are that we are seeing are long and short-term health issues, safety concerns, of course, loss of life. Many people have lost jobs and have had changes in their workload. Many people are working in hazardous conditions as a result of the pandemic. Also, working from home has been a stressor for many people. Due to loss of jobs, there's been lots of income, financial problems, And then the additional stressor for some people of having to apply for assistance or seek financial resources in other places. Many people, because of the pandemic, have had to stay in abusive relationships or have experienced strain in relationships because spending a lot of time with people can, without being able to move forward or go other places, can cause strain. Also, we've had to isolate from each other, not being able to see family, not being able to travel, and concern over death over loved ones. School, for many of the children, they've sacrificed a lot over the pandemic. Many of them had to do virtual learning, which a lot of them have reported to me that they haven't really been able to learn much because the learning they've had to do it on their own. People have dealt with childcare issues. And then if you have a child with special needs, that's also an additional stressor because you may not have been able to get the support that that child will need. So how do these stressors, how do this affect us in our lives? So the effects of the pandemic stress, you may be seeing this in your mood, feeling strong feelings of fear, sadness, worry, anger. Also, many people in practice have reported a sense of feeling numbness, where they've felt all of these feelings and now they can't even feel anything at all anymore. And they're kind of moving through life in this numb state. Lifestyle changes, something to pay attention to, changes in your sleep, appetite, interest, and desires. Practitioners are reporting a thing called coronasomnia, which is if difficulty sleeping, problems with sleeping issues as a result of COVID. Also, many people are reporting cognitive difficulties as a result of pandemic stress, difficulty concentrating, memory loss, challenges with focus, and challenges in making decisions. Physical, our body always will hold and react to stress and anxiety, so we will hold that in our bodies. So we will experience things like body pain, fatigue, sometimes headaches. And of course, there will be times where chronic conditions will be worse as a result of stress. Behaviorally, people will cope with using tobacco, alcohol, other substances, food, isolating, sometimes just watching TV. We can gravitate towards anything just to help us cope. Mental health wise, there's been definite spikes in anxiety and depression. So on mental health, this is a statistic that has been taken from the Children's Hospital National Poll on Children's Health at Michigan Medicine. And we're seeing that this is from parents reporting anxiety increasing, depression increasing, sleep issues increasing. And this is from their teenagers that they're seeing that. And in my practice and when I'm seeing with children, teens, and families is a lot of depression and anxiety. And so let's talk about those two main, depression and anxiety. And I want to go and get into what is the difference between stress and anxiety. Stress is a response to an external cause. So a test, an argument, something that's outside of us that's happening. Usually stress can be resolved once that stressor is gone. So now you're not going to be experiencing the same level of tension, frustration, worry. But like we said before, stress can be positive. It can help with increasing focus, make you more productive, but it can also result in loss of sleep. And there are things, other tension that can build up from chronic stress. Anxiety is more internal. This is your reaction to stress. And anxiety is persistent. So even when the stressor is gone, the anxiety continues. And anxiety is constant. And the problem with anxiety is that it becomes something that you hold on to in your body. So some people will hold it in their shoulders. Some people may hold it in their minds, in their bodies. So really paying attention to anxiety and where do you hold it in your body? So I also want to talk about depression because this is on the rise. Depression and anxiety and stress all we've seen them kind of come together. And if you're experiencing any of these types of depressive symptoms, it's a really good idea to talk to someone about this and paying attention to what's happening. Some people's depression actually comes out as more anger and irritability, and other people draw within themselves, and their depression looks more like sadness and guilt, maybe even some isolation and loneliness. So paying attention to what your depression looks like, but not just for you, but you're the one that's around your family, friends, community members. You're the one that's around your children. So checking in on them and paying attention to what's different in their behavior and their mood. So when is it time to seek help from a mental health professional? So as a professional, I think that it's very important to get routine checks, mental health checks. Just like you are going to a doctor for a checkup or a dentist for a cleaning, it's a good idea. But now that we've all experienced and are currently experiencing a pandemic, this is even more of a valuable time to get a check-in and talk to a professional. But I wanted to discuss a few of the reasons that people come to see me. These are some of the most common reasons, and to see other mental health professionals. If you are feeling overwhelming emotions or feeling anxiety most of the time, if you're having emotional struggles that interfere with your ability to live a healthy lifestyle, manage your responsibilities at work or home or in relationships, if you are having any thoughts of harming yourself and or others, it's very important to talk to a counselor or a suicide prevention counselor. Struggling with substance abuse or other addictions. If you had a significant life change or loss, so many people are dealing with grief, and grief is also including the death of a loved one, but grief can also be ending a relationship, ending a job. Grief can come in various forms. If you have any issues with disordered eating or eating disorders or struggling with body image, if you have ever experienced abuse at any point in your life and still are coping with that trauma, if you have difficulty communicating effectively with the people in your life, which is many of us, that would be a reason to see a therapist. If you're having difficulty with your own sexual orientation or the sexual orientation of someone in your life. So these are all reasons that people, some of the major reasons that people come to see a therapist. So why do we need to have integrative therapy? What is the purpose of that? Why is that important? So integrative therapy is a progressive form of psychotherapy. And as an integrative therapist, I am seeking different theories from different psychological schools of thought, and I'm putting them together to see what would be best, what would help this person that I'm talking to. So I want to create an individual treatment plan. And integrative therapy is very much a collaboration between the therapist and the client. We're working together to understand what's going on and to gain insight. So before we get into the actual models of integrative coping, I would like to talk about adaptive strategies versus maladaptive strategies. And it's not necessarily completely black and white because there are some areas of gray, but adaptive strategies are ones that diminish stress. These are the coping skills that help you tolerate, minimize, and manage stressful situations. These ones will give you more information, provide feedback, and adaptive strategies are ways to help you learn from the stressful experience. This is including good physical habits, practicing relaxation techniques, seeking support from other people. Maladaptive strategies are temporary reliefs from stress. This is sometimes like, I just need to not pay attention. I need to escape from this. And sometimes maladaptive strategies are okay in the short term, but long-term maladaptive strategies become dysfunction. And we can learn these maladaptive strategies from our upbringing, from culture, from places that we have been, like our work. And some people, for example, if you're stressed, working more is a maladaptive strategy that you may not even recognize that you're doing. So these are some strategies that might provide temporary relief, but they are dysfunctional if used continuously and they're not productive. So let's get into the model. The first model is the appraisal problem emotion focused strategy. This is used often. We use this with kids. We also use this in colleges. It's also used in prison systems to help people learn how to solve problems in more healthy, long-term, providing a long-term type of solution. So appraisal-focused strategies are really about appraising the situation and understanding and gaining insight. Why is this happening to me? So using things like rational thinking, positive interpretation, turning to religion. This is also ways of changing and reframing the way that you're thinking about a situation that might be coming up. Problem-focused strategies are active in problem solving. Many people tend to gravitate to one or more of these strategies. Problem solving is seeking support, enhancing time management, finding a way for you to control the problem. Emotion-focused strategies are ways to release what's happening inside, releasing your emotions, exercising, meditating, even talking to someone about the emotions, even sometimes distracting oneself. It's a really good idea to talk when you are talking to a therapist and having a collaborative process to start recognizing which strategies am I naturally drawn towards and which ones am I neglecting. Because sometimes we tend to naturally draw to one and then we have neglected our emotions, or maybe we've just been focusing on solving the problem, but we haven't looked at the bigger picture. So the next model for coping is the core strategies model. I use this a lot. I think this is a very effective model to use with younger children, and it also includes a very integral component, which is the creative strategy component. But first, I want to talk about the first one, which is attention-centered techniques. So this is meditation, breathing, visualization, and also using such techniques as grounding. Many therapeutic theories and very many schools of thought come from like a mindfulness perspective, such as dialectical behavioral therapy. It involves a lot of attention-centered techniques, using your sensations to manage your anxiety and to minimize that anxiety. Expressive creative strategies are very key and often overlooked. You can be creative in the most minor ways in life, and that will not just decrease anxiety, but it increases happiness. So expressive creative strategies such as working on a garden, arts project, even if you're cooking a recipe or dressing yourself for the day, adding some creativity to that is adding some happiness to life, and it minimizes your thoughts and focus on problems. So the reflection, exploration strategies, these are the strategies that you use to learn more, to gain more insight. Journaling, self-monitoring, making checklists. Sometimes these strategies we think are very, very effective, but they're actually causing more stress. If you are a list maker, but none of those lists are getting done, then you're actually not doing something that's going to make you feel productive. And in this area, why I highly promote talking to a therapist, because you may believe that, hey, I have insight, I know what's going on. But when you have the support of a professional that is there to work with you, you may gain some more insight in how can I do this more effectively? What will make me even more happy? What will reduce my stress and anxiety in the long term? And the final thing is a healthy lifestyle. This is pretty much the core of all mental health and health in general, of course. But good nutrition, good relationships, quality relationships, exercise, and finding what works for you specifically is the key to having a comprehensive mental health, and also for overall reducing anxiety and stress. So we know that the growth is uncomfortable, messy, and full of feelings that we weren't expecting, but it's necessary. Everyone's been through such a difficult time, this pandemic, but now we can start to look to the future and find how do we want to move forward? What do we want to do differently? And there is no life without challenges. Just how do we manage it? Everyone has them. These are some of the references of this talk if you want to get more information or read further. And thank you all so much for listening to this talk.
Thank you, Selvi. Great, excellent talk. And, it's just opened up our minds to what are the cues that we need to help understand ourselves. What I'm going to do is we can have the question answer session at the end, because I'm sure there's going to be a lot of great questions coming up from the panel. So without any further delay, I'm just going to move on to the next speaker. Vanakkam, as Dr. Selvashanmugam. And it's a great pleasure to introduce Dr. Selvashanmugam. And most of you who come to this webinar on a regular basis have met him previously, but at the same time, let me introduce him formally to the newcomers. Dr. Selvashanmugam did his bachelor's in Siddha medicine in 1987 through 1993 in Madurai Kamaraj University. Then did his MD in MGR University, and subsequently did his PhD from 2003 to 2007, and has been working in Health India Foundation since 2011. Dr. Selvashanmugam got introduced to the Tamil community in USA more than 10-15 years ago. And he wears various hats, but his mission, he's been one of the instrumental physician in working to bring GCSMR together, and the collaborative effort between India and US. And I can go on and on. He's he's been a guest speaker in all the various Tamil organizations, PETNA, TNF, Atma, all the organizations. He's also a visiting professor, Morehouse University, Veda Center. He is a great researcher, has more than 35 papers published, peer-reviewed journals in India and also in integrative journals in the US. And without any time delay, I want to turn the podium to the Zoom podium to Dr. Selvashanmugam.
Thank you, Dr. Shankari, for introducing me. And also thank Selvi Chellaiah for a great talk and about the coping with the pandemic strategies. So can I have the slides to share?
But Selva, you can share, it should work.
Okay.
Yeah, it's on, it's coming now. If you make it big, it'll be better. Okay, got it. Everything is
see the slides. Okay. So good morning, everybody in US, and good evening from other part, India and Sri Lanka and Malaysia. So thank you for introducing me, Dr. Shankari and Sivasailam. So உள்ளுவதெல்லாம் உயர் உள்ளல், மற்றது தள்ளினும் தள்ளாமை தீர்த்து. The extract of this Thirukural and ancient Tamil literature is to keep our thoughts always higher and try to achieve them. So in just the last few years, hundreds of academic papers have been published studying the health effects of positive thinking. Expecting good things to happen is called dispositional optimism. They have linked the positive outlook on the life to everything from diseased feeling of loneliness to increased pain tolerance and compassionship. We all know that positive thinking is good for immune system, reduce anxiety, and increase positive emotion. So how to achieve a stress-free life in traditional way? So before moving on to the topic, I would like to tell something about the system of medicine for new friends for this webinar. So Siddha system of medicine is an ancient medical system of the world, approximately 10,000 BCE to 4,000 BCE. Many researchers to be more than 5,000 years old. The system is providing preventive, promotive, curative, and rejuvenative and rehabilitative care, adapting scientific and holistic approach. So the system of medicine is practiced in many Asian part of the country. Siddha strongly believe and practice the concept for complete cure, body, mind, and soul need to be treated as a whole. So Siddha consists of 3 phases of treatment. First one is the Kapu. It is more or less equal to the modern community and the preventive medicine. The next one is the Nikam, that is the curative aspect. Then third one is the Neripu, restoration of the people to their full potential of good health after any sickness. This is very similar to the cellular reprogramming mentioned in the modern medicine. So COVID is linked with many anxiety conditions and stress. Selvi Chellaiah covered about this personal stress, family stress, and professional stress. So these are all the questions in mind of the general public. How long does it COVID virus affect? If affects, how long does it take to recover? These are all some questions related with the personal stress. These are all some questions related with the family stress. Is homeschooling likely to end? When to self-isolate? How long to self-isolate? These are all some questions related with the family stress. The more important is the professional stress, the financial insecurities, losing job, dealing a different workload. These are all some conditions related with the professional stress. Before discussing the coping strategies, I would like to tell about the preventive and successful Siddha treatment. The first one is the primary prevention methods mentioned in the Siddha system of medicines. Many prevention methods are mentioned in the ancient Siddha literature. There is the lifestyle-based and diet-based and Siddha medicine-based. These are all available in our GCSMR website. Please go through it. And these 3 drugs are very effective against the COVID in preventive care. The first one is the Nilavimbukudidir, Amukra Churanam, and the Nelika Lehi. These 3 drugs are effective in preventive care. So next one is the Siddha treatment. COVID was effectively treated by many Siddha institutes, Siddha teaching institutions under Government of India and Government of Tamil Nadu. Central government institutions like Central Council for Research in Ayurveda and Siddha, National Institute of Siddha, MGR Medical University, Directorate of Indian System of Medicine are actively involved in treating the COVID diseases. More than 1 lakh patients benefited from Siddha alone in Tamil Nadu. In our experience with the Health India Foundation and other some related charitable organizations, we encountered many, more than 2,000 COVID positive patients. They are asymptomatic or symptoms, COVID with mild to moderate symptoms. So out of 2,000 COVID patients, only less than 10 patients were referred to the intensive care unit and 2 patients succumbed. So many studies reported that IL-6, CRP, ferritin, and other inflammatory markers are early indicator of cytokine storm-like conditions. Siddha drugs are significantly reduced the levels of inflammatory markers in many clinical studies. There are many coping strategies mentioned in Siddha literature. In this webinar, I would like to cover Siddha diet and home remedies, Siddha lifestyle, and Siddha yoga, including asanas and breathing methods, Varma points, and mudras. The first one is the diet and home remedies. So the conscious eating. So eat slowly, enjoy every bite. Eat with 5 sense organ is the fundamental thing for conscious eating. A good way to get started is to try this simple exercise with a green gram sweet ball. Put a green gram sweet ball in your mouth and close your eyes. Do not begin to chewing yet. Then notice the texture, temperature, and taste. After observing these senses, begin to chewing with a slow pace. Notice what it feels like. Notice how to feel your jaw move each time you chew. Swallow slowly and take a deep breath and open your eyes. You may find it helpful to do a similar exercise with first bite of every meal. This is called conscious or 5 sense organ eating. This is very effective method for reducing the stress level. The next thing is Siddha diet and home remedies. First one is the Adimadaram tea. Adimadaram is in English name, there is the licorice. The Sanskrit name is the Estimadu. The combination of licorice, haritaki, kadukai in Tamil, dry ginger, pepper, poppy seed. This is the combination. With this combination, making tea, it is very effectively reduce the stress level. Then the next one is the nutmeg tea, the combination of jadikai and sukku, nutmeg, dry ginger, along with the honey. This is effectively this is effectively controlling the stress due to many reasons. At these conditions, it is very effectively managed with the respiratory tract infections with the nutmeg and licorice. The next one is the Karisale powder. Karisale is Eclipta prostrata is a botanical name, Bringaraj is Sanskrit name. The combination of Karisale and pepper, give 1 teaspoon early morning along with the honey will reduce the stress level. Then the flaxseed sweet ball, the combination of flaxseed, sesame seed, pepper, ghee, and palm jaggery. The next one is the black gram porridge, the combination of black gram, organic rice, fenugreek, coconut, ghee, and palm jaggery. Next one is the amukara powder, that is the ashwagandha powder, the combination of amukara pepper, dried ginger, and cardamom. These are all the effective Siddha diet and home remedies to overcome the stress level. The combinations are very effective. The amukara has multiple health benefits such as boosting stamina, immunity, reducing the inflammation, and fighting of the cognitive and neurological disorders. Karisale is also very effective. That is, Eclipta prostrata effectively detoxifies the whole body, promote oxygen supply to the brain, and ultimately reduce the stress level of each and every individuals. Nutmeg works as an antidepressant. So these are all some Siddha diet and home remedies, very easily available in all over the world, especially in US. So use this base ingredients to alleviate the stress level. So Siddha lifestyle is also very important for overcoming this stress level. We manage the sleep level, yoga, exercise, drinking adequate water, especially Niragaram. The cold rice fermented water, drinking in the early morning is very effectively benefit not only to reduce the stress level, it is also effective against many diseases. So periodical bowel cleansing methods. So the combination of edible castor oil, ginger juice, and honey, take once in 4 months is effectively detoxifies the whole system and effective against anxiety and stress level. Periodic herbal oil bath. The simple herbal oil is the combination of sesame oil and tulasi. There is Arsimum sanctum, there is holy basil in English. So the combination of sesame oil and the holy basil, take oil bath with this oil, the rejuvenate the entire system. It detoxifies the whole system and it enhances the physiological functions of the internal organs. These are some common Siddha lifestyle methods to overcome or coping with the pandemic stress. So next is Siddha Yoga. So improves the quality of life with the yoga practices is very important. The first one is the Nala Asana. This is a simple, easy pose. This is also called as the Sugashana. Start by sitting down with your spine straight and leg extended in front of you. Align your head, neck, and spine. Pay attention to your breathing. This is the simple asana to overcome the stress level. The next one is the Nindra Kokasana, standing forward bending. It rejuvenates the entire system. It enhances the blood circulation. The next one is the Kulandai Asana. Child pose is also very simple and effective method. The next one is the cow and cat asana position. Is a gentle flow between the two poses that warms the body and brings flexibility to the spine and ultimately leads to the relaxed state of mind. The last one is the Savasana. This is a resting pose. Spends several minutes with this asanas with your system. It's very effective against the stress level. Sun salutations should be practiced only after proper training. This is also very effective against the stress level. The next one is the conscious breathing. So conscious breathing is an important method of relaxation. This is very, very simple method. You can do it at any parts of your life. So many people get into the habit of breathing only with their chest. With the restricted clothing, poor posture, and stress also contribute to the chest breathing. So conscious breathing is also known as the abdominal breathing or diaphragmatic breathing, not chest breathing. Breathe through your nose. We should experience the air moving through our nostril into the abdomen and making our stomach expand. During this type of breathing, make sure your abdominal wall moving outward while your chest effective stress level. The next one is very simple method is Om Pranayama. Sit on the Padmasana. Padmasana is an effective asana method for doing this Om Pranayama. Close your eyes. Your spine should be straight through your nose till diaphragm is full of air and exhale slowly. While exhaling, chanting Om, like Om, as much as possible. So repeat this Om Pranayama 3 to 5 times per day. It is very helpful in improving the concentration. When you chant Om, you will get energize the whole system and your worries and tensions will relieve from your body and mind. Reduce stress and anxiety. According to the recent medical research, many medical research, chanting Om has been associated with reducing the stress. Regular chanting ensures that you feel peaceful. The other simple benefits are mentioned here. The sound sleep will occur after Om Pranayama, emotionally stable, improve reasoning ability, reduce the negative effect of the mind. So this is also a very simple method to overcome the Om Pranayama. So next thing is simple Varma stimulation methods. The first one is the Tilarda column. This point is in between the eyebrows mentioned in this slide. So you just press and give upward movement with the middle finger thrice a day will effectively overcome the stress level. This is one point. This is simple Varma point. The stimulation method is also very simple. Stimulate with your middle finger, just give upward movement at this point. The second one is the Annan column. The point can be found in the depression of the temples. The point is mentioned in this photograph. Place 2 fingers on each of your temples and apply slight pressure. Give simple pressure and clockwise and anti-clockwise movement, circulatory movements for just 2 minutes. This will help to improve concentration and memory. It will also relieve from headache, dizziness, and mental stress. This is also a simple pressure method mentioned in the ancient Siddha literature. Then this one is the male Udattu Varmam. So place your finger right between the upper lip and the nose. The point is clearly mentioned, indicated in this slide. So press this point firmly for few minutes every day. This point relieves stress, memory loss. It also helps the strengthening of and brain and increase the memory power. This is also a simple Varma point for stress relief. Then we would like to see some mudras. The first simple mudra is Jnana Mudra. Touch the tip of the index finger with the tip of the thumb is Jnana Mudra. The other 3 fingers, you may keep it straight or just it free. So the benefits are increase our concentration and memory power, sharpens our brain power, cures insomnia, heals all mental and psychological disorders like anger, stress, and anxiety, depression. This is simple method. The next one is the Uyir Mudra. Uyir Mudra is just bending your ring finger and little finger and touch the tip of the both fingers with the tip of your thumb. This mudra improves our immune system, increases our eye power, also cures any sort of eye diseases. It also reduces the anxiety and depression, tiredness. This is also simple mudra method to overcome stress level. The last simple mudra of this session is Buddhi Mudra. This mudra is performed by touching our thumb to little finger while holding our other 3 fingers straight position. This is the Buddhi Mudra. It gives mental clarity and creative thinking. We covered the Siddha Yoga and a healthy diet and healthy lifestyles. So we just follow these simple methods and we have moved to the stress-free zone. So there is no more Able to hear?
Yes, go ahead, Dr. Selva.
Yes,
Okay.
doctor. Yeah.
Just there is no more deadly virus than the fear. So medicines are not going to work without courage. So thank you so much for everyone. If you have any questions, please ask me. Thank you so much for all the participants of this webinar. Thank you.
Thank you, Dr. Selva. It's a very good presentation, followed by Dr. Um, your presentation and Selvi too. Before we are going to the, I know everyone is so excited to about the question answer session. We'll be starting that very soon. You may have a lot of questions. We also been conducting this webinar every month, and we have a WhatsApp group for this. If anyone interested to join this group, please put your number or your email in the chat, or to the GCSMR at gmail.com, gcsmr20@gmail.com, or you can call me anytime, or Dr. Rama. We are always there to help you. Before going to the question answer session, as a secretary of this GCMR, I would like to thank everyone for attending this session and for our sponsors. The main idea of this topic came after my personal experience during my visit to India. Last year, like 2020, I lost my father in Chennai, but I couldn't go for his funeral because of the COVID pandemic situation. And I was waiting to visit my mom for nearly 9-10 months. And finally, I was able to go in March. So I was so careful when I was traveling with my mask and all those things. Somehow I couldn't take my vaccination. So I was planning to go and take that. And unfortunately, I got infected with the COVID after I went there. So as you know, I was so scared, and that immunization level from people like us, we are going from US, it's very less. And I have a very old mom to take care, and she was expecting me to take care of her, but I was there and I got sick. And the situation is so worse that the pandemic there, what really in the peak in Chennai, cities like Chennai, there is no places to go for in the hospitals, even for testing the COVID. There's a long queue standing. It was really scary to even step outside the house. So at this time, I'm very fortunate that I was able to contact Dr. Selva through phone, and with his guidance and with this effective treatment, I was able to go through this COVID stress really well. And I was really bouncing back from my virus within a week. And even after that, his treatment is a very meticulous treatment, gave me the strength to come back to US within a month, and I became negative for COVID. Even after I came back here, I went and checked with my PC with all my indicators, blood work. I did everything. Everything is supposed to be very good. Now I am very healthy. So why I am sharing this is it's very important for us to do research on this. This our Siddha. We all know that Siddha is very ancient system, and we know this is working for most of us, and it's always a choice. We can go for that, but not everybody is lucky, or not, it's not available to everybody unless we prove it to the modern society in the Western medicine that it is also a system that works. Unless we prove it, we cannot take it further. So it's very important for us to do the research and all these things. So our GCSMR's main aim is to do this. That's our logo, and this is our target. So we have been doing this as a first step. You all know we have signed up a MOU with the Manipal University. There'll be a lot of questions. Why in Manipal? See, this system, this Siddha, it shouldn't be content within Tamil Nadu or within a certain, boundary. It has to go all the way to the country and to the world. That is our main aim. So to establish this as a national way, or in the global way, we have to get out of this language barrier or the Tamil Nadu or state barrier. So Manipal University, Dr. Arul Amadan, one of the advisors in our advisory committee, he is from Manipal University, and he is a pharmacologist and also MD in Siddha. With his help, we have able to establish sign a MOU with Manipal University, and they have offered us graciously to match our fund in the university and do the research center there, where like a lot of patients like me will be getting us an integrated way of approach for the Siddha medicine in most of the diseases. So it's very important for us to open this center. We are so thankful to all the sponsors who already donated for this cause. Still, we are very much need in fund. Our July 31st, the end of this month, we have to pay our first payment, and still we need more sponsors. I would personally request you all to come forward and do your donations for this. In Tamil, we say Yan Petra Inbam Peruga Vayagam. So whatever I experienced with my thing, I know there's a lot of stress going on there with the COVID pandemic. And so what I went through is a really bad time, and how I came out with the help of Siddha, which was available to me at that time. It's not about this particular system of medicine is good and this is bad, not like that. So we have to come out with the best way of medicine, where we can integrate many things from many medicines and many form of treatment. It's the best way to integrate all this Siddha form of medicine and modern way and all these things. So I will request all my friends and who attended this meeting to come forward. I don't want to take more time. All information is available in our website. It's www global Siddha research. And if you want, I can put it in the chat. You can go on all the remedies and the way of living and everything is available in our website, and you can contact us anytime. And also we have some wellness coaching that you can do personally with Dr. Selva or Dr. Arul. You can contact us anytime. With this, I'll go to the question answer session. I'll be posting some WhatsApp groups link and a website address in the chat session. Thank you all.
Thank you, Tamarai. Thank you very much. I'm sure that we have a lot of participants, and thank you to Dr. Selvi and Dr. Selva. Excellent presentation. Lot of good points, take-home messages. And I would open the forum for question. You can unmute and ask the questions to the speakers, please.
You can also ask questions in the chat box if you don't want to.
I had a question for Selvi. And I just wanted to ask how you would recommend reducing stigma in the Tamil community and in the South Asian community for getting therapy, and how treating that population is different from treating other populations.
Nithya, thanks for the question. It's a great question. I honestly would like to hear more of our parents' generation talking about going to therapy and connecting with therapy, because it is becoming more common with us. I hear back in the day, people would be whispering like, I was going to a therapist. Now they're like, you won't believe what my therapist said. So within our own, I think it's the stigma is reducing, but I don't see as many people who are, our parents, and they are experiencing so much, just like Auntie was talking about her experience in India, going through COVID, the struggle and dealing with parents that are getting sick. Many of our family members are experiencing grief, and it is difficult to find a therapist that may connect with them. But I would really be very proud and excited to hear one of our parents going to therapy and talking about it and making it normalized.
Thank you so much.
Thanks, Cynthia.
Dr. Selvi, thank you again for taking the time. This is Pradeep. I had a follow-up question to that. how do you pick a good therapist?
This is a great question too, but I wanted to also let you know I'm not a doctor. I am a master's level, so I'm a licensed clinical counselor licensed in Maryland. But the relationship that you have with your therapist is very unique, and you want to make sure that's a good fit. And so understanding that, it is almost like trying different people, talking to different people, but there is if you are in the United States, there's a great website called psychologytoday.com. And most therapists who are who are looking for or have availability will put a profile on that. And you can search by the kind of therapist, the training that they have. You can even search by whether you want to talk to a male therapist, female therapist. And also by insurance. So it is a process to find that collaboration and that right fit for you. But when you do find that, don't give up, keep going. And also you want to make sure that you're in a relationship with someone, a therapeutic relationship with somebody who is like talking about the same type of treatment goals that you have. So you want to make sure that they are connected with you. If you're looking for something with anxiety and depression, you want to make sure that they're hearing you.
Hi, Selvi. Can you hear me? Is there any online therapist instead of face-to-face? People can, comfortably do that online. Is there any services like that?
Yes, there are lots of different services like that. And as I said, you can check on psychologytoday.com in the United States, and most of the therapists will advertise a telehealth option. I offer almost all of my therapy online. Previously, I was providing therapy face-to-face. If there is a higher level of need, I will prefer to see someone face-to-face. And also for younger children, I do prefer to see them face-to-face. But yes, I understand right now it's a time that most people are offering telehealth services. And I would check with the therapist to see, because people are now able to do therapy from remote locations. So I was doing therapy with a truck driver once. So you can, as long as the licensing is okay and he has a residence in Maryland, I'm allowed to provide therapy for people in Maryland.
Thank you.
Selvi, I just wanted to share a point to answer your question from the auntie generation, because you raised a valid question like, how do you feel? What are the barriers? I think more so than a barrier, I think, I was looking at your presentation with Model 1, Model 2, how we cope with stress. I think our generation is actually using your core model strategy, Model 2, because attention, reflection, expressiveness, and healthy lifestyle. So I think a few years ago, with the introduction to the Siddha Wellness Group sessions that we follow, do yoga, meditation, and in fact, when we meet, we give kind of group therapy to each other, and maybe that is sufficient enough that we are not reaching out to our specific needs. But you raise a valid point. It's not a taboo to us, but I think we are so busy with our personal life, taking care of family members, and we don't think of it in a specific way to reflect on what is bothering us. But I think you have opened our eyes to that. And in addition to what are the things that coping strategies you talked about, we should also individually reach out to get over our personal anxiety to help grow. So that's something I learned from your talk. Thank you, Selvi.
Sure, and I want to say this is an amazing community. I can definitely see the benefits. My parents, my family has so many benefits being part of this community. It's just a larger family. So it's a wonderful privilege to be part of it. And I do see that, Auntie, that you're talking about living that 4 core strategy lifestyle does involve creating a community. And I think that when you have weekly yoga, it's with your friends, it's easier to maintain that. And when I saw dealing with our own family grief and some of the other families, we all came together as a community for that. And there is a huge level of compassion and support, just knowing that we have each other. So.
Selvi, I have a question. When do you recommend group therapy versus individual one-on-one therapies?
So some people, if they're more introverted and they don't really like to share with a lot of people, but other people, group therapy is so effective for them so that they can relate to other people who are going through the same thing that they've gone through. Also, group therapy helps with having a moderator like a therapist so that everyone can share. And one great thing about group therapy is people are in different levels of progress. So one person may be starting their therapy experience while another person is a little bit ahead. And usually they kind of collaborate and find a way to support each other. And I've noticed that for kids, it's very effective, especially for teenagers. Developmentally, it's important for us to meet friends and meet people who are in our same age group, because healthy birds fly the nest, and we want young people to meet other young people to talk to about their issues. We want people of your age generation to meet people so that you know what you're going through. You can discuss the same sort of developmental milestones that happen together, because you're all sort of experiencing that. Even though your experiences might be slightly different, you will have major life events that you will share.
Dr. Selva, as a follow-up question, in Siddha literature or in your practice, how much importance is given to counseling? Because counseling is something where there are people who don't like to take medicines, but most of the Siddha medicines are Siddha home remedies that you talked about. I know it's natural food stuff and things like that, but is there anything specific similar to what like counseling or therapy in Siddha literature?
So there is many things. There is a holistic approach of Siddha system is mentioned in the ancient Siddha literature. In Tirukkural is also mentioned the 4 different parts: the patient, physician, medicine, and the attender, medical attender, the 4 different parts. So each and every one, except medicine, each and every one has its own role to overcome any diseases. So it covers the counseling is a part of this protocol. It's mentioned in many Siddha literatures also.
I had a question for you. If because of this pandemic stress and everything, there are a lot of people coming out of the woodwork saying they know Siddha, and people pay thousands of rupees to get into. They go there and get Ballari Kiri or something and come back, and they pay thousands of rupees and get treated. So how do you recommend we find out, if this is someone who has the right qualifications to provide Siddha medicine?
So Siddha medicines in Tamil Nadu and all over India, there is a certification cost called as ISO certifications. So many other GMP certifications are given by the government of India. So good manufacturing practice certification is essential for selling any medicines. So any company with the ISO or GMP certifications in their label is authenticated one. So without that certifications, we can't recommend that particular medicines.
How about doctors?
Doctors, there is also the certificate given by the central and the state government. There are 2 things. One is the institutionally qualified physicians. That is called Bachelor of Siddha Medicine and Surgery. This is the degree name. Then the MD Siddha or PhD in separate institutions. The second one is the traditional practitioners. That is called RIMP, Registered Indian Medical Practitioners. Now it is banned for last few years due to some malpractices. So the 2 things are Two types of physicians are only authenticated by the government of India as well as the Tamil Nadu.
We have some, sorry, doctor, interrupting in the middle. There is some chat going on, and we have the degrees that been put there. Siddha degrees BS, MS, MD, and Siddha RIMP. It's a very good question because I myself was came across many things, and we have been getting calls from lot of attendees from GCSMR that which is authenticated, which we have to find. We also have a lot of guidelines in our GCSMR website and WhatsApp groups that not to forward any because there are a lot of things coming now at this time, like, okay, this is Siddha medicine, do this, do that. So Dr. Selva and Dr. Arul, without their consultation, we are not forwarding any of those things. As you know, there are a lot of malpractice going in every field like that. Even in Siddha, there are a lot of things going on. You have to be really careful what messages and who is saying that. As Dr. Selva said, that they have to hold a degree in Siddha. And for myself, I have a lot of questions, like I've been taking that's Nilavemba and all these things. So I don't know whether it's really working out. And later on, I found out when I went to Chennai that what I was drinking, the Nilavemba, is not the recommended Nilavemba Kudineer. So this Nilavemba different from Nilavemba Kudineer. So a lot of things that we have to be careful, because Nilavemba Kudineer has a combination of some like drugs or a combination of herbs, but where just Nilavemba is only one herb. So a lot of things are there. So it's always better to consult a Siddha doctor before you take any medication or anything like that. And when you buy Siddha medicine, so you have to always look for that ISO or ISI emblem that is registered, and it's a good Siddha medicine. Thank you.
Thank you, Chanda. So I see a question in the chat from Surya from Iowa University that I would like the panelists to address. மனநிலம் மேம்பட என்ன உணவுகள் உண்ண வேண்டும்? இறைச்சி, முட்டை, பால் பொருட்கள், பால் போன்றவற்றை உண்ணலாமா? Surya from Iowa University. Dr. Selva and Dr. Selvi Dr. Selva and Selvi can take the call. The question one at a time, please.
First, Selvi, you.
Can you say the question again, Auntie?
The question was, for mental health, is there any specific food item that you would recommend as a therapist? And can we eat meat, eggs, milk products? Is it allowed if for mental health stressful situations? What are your recommendations from your end?
Well, I'm not a dietitian or a medical doctor, but I definitely think if you're having anxiety, reduce caffeine, drink more water. I can't speak to whether you're gonna have eat no meat or no meat. These are like choices that you have to make based off of your own health and your specific issues that you need to talk to your doctor about. But we all know that eating less processed food overall is a better option. So I'm sure Dr. Selva can maybe even give more specific information about this question.
Okay, thank you, Selvi. So in ancient Siddha literature, so non-vegetarian diet is not recommended by the Siddhas in ancient literatures. So lately, after 16th century, there is a non-vegetarian diet are included in Siddha, Padartha Punasindhamani and other literatures. So, so I would recommend, the first thing is pure cow's ghee is effective against stress. Then black gram, urad dal in North India, it says North India. Then green gram, coconut, fenugreek. These are all the important things to enhance the mental strength. Then all the spices in our kitchen, there is a dried ginger, garlic, onion, cardamom, that is clove, star anise, all are having the stress, that is the anti-anxiety properties. These are all very effective against many stressful conditions. So if you give some tulasi tea, that is the holy basil leaves with the pepper, or ginger tea, it gives you more stress-free events. So try to avoid coffee and tea. Take herbal teas. Many, there is hundreds of herbal teas are available in the Siddha literature. You use, avoid coffee and tea. Take that type of green tea. Green tea means that is a herbal tea. It's not related with the common tea. It's only herbal preparations. You may take cardamom with clove. You may take ginger with coriander. You may take mango leaf with ginger. There is many tea mentioned in the Siddha literatures. It is very effective against the stress conditions. So ghee is the main thing for stress relief. 3 teaspoons of ghee in the morning with the breakfast and 3 teaspoons of ghee with lunch is effective against stress. This is clinically, we saw many patients.
Thank you, Dr. Selva and Selvi. As I'm a medical oncologist, so I give my perspective of, I do see a lot of patients. We do somewhat counseling when they are, they have to deal with, life-threatening illnesses on an ongoing basis. So I feel like, when you look at diet, like, in an integrative approach, I all truly believe that one size never fits all. And we have to look at ourselves as a mind, body, spirit approach. So when you're dealing with stress, food alone is not the answer, right? You have to, as Selvi said, look at the root causes, and Dr. Selva's like lifestyle, so many things. So I think from a food perspective, I tell my patients, think of the food source. Where are you getting your source? Like the processed food, like, certain times you're used to certain foods, how you were raised and what you were exposed. Suddenly you change that, it's not going to, improve wellness, right? Especially mental health. So I would say that look at your food sources. I mean, my feeling is like, all the milk products in the modern times, look at the food source, because, antibiotic or like, induced chicken and milk products, if you can afford organic or farm fresh, those are the things I would focus on, because if your body is used to those products, you eat in moderation. So in other words, we cannot completely avoid one food to fix a disease process. So that's the approach I would take. So I just wanted to mention that. And there was another question, thanks Dr. Shanti Raja, one of our scientific advisors, and she posted COVID, the Delta variant coming out in the open now, even in the US we are seeing. I would again remind everyone, vaccination and masking, hand washing, all the 3 things are the key to fight this. So I have to share this in our hospital, like, we were all vaccinated. Another physician got COVID, became COVID positive. So what I'm saying is that we are still not out of the woods, but if we follow the rules and follow the lifestyle modification and what Dr. Selva has been preaching in the past year, it really helps us. I just feel like, I take I'll drink my Nelavemba Kudineer every week. I take my Nellikai Legium, Amukra Churanam, and I feel less anxious when I go to work, to be honest. So I should say that it gives us, of course, I'm vaccinated and I follow rules, I wear my mask, but I think those are the tools that help us, go through this process. So any other questions from the audience?
Yes, Shankari, this is Dr. Gopal. Presently at your house, thanks for all the best things you have given, including Nilamembu Kudineer and Amukachurnam and Nellikai Legium. And we are living in an ashram. Thanks to you. I have a question for Dr. Selvashanmugam. And you mentioned about all those herbal medicines, which all of us would like to take it. But as a doctor, as I've prescribed many of antidepressant and anti-anxiolytic medications to my patients, and I'm thinking of combining this with some of those Siddha medications. What are the interactions? Should we or should not counsel those patients? When you take these medications, you cannot take this Siddha medications and all those kinds of stuff. So I would like you to talk about interactions of the allopathy medicines and Siddha medicines in perspective to psychiatric medications. Thank you.
Okay. Thank you, Dr. Gopal. There are two things mentioned in this webinar. So the one is diet, lifestyle, and home remedies. These are all not interact with the some standard medications of standard modern medicines. So some Siddha medicines, like Siddha preparations, like Muttu Parpam, Sangha Parpam, Brahmi Viridam, these are all the prepared medicines. But in prepared medicines have some protocol with the mixing with the modern medicines. We are running here in Chennai, is an integrative medical center. We have one modern medicine doctor and along with some Siddha doctors. So many Siddha drugs doesn't interact with the modern drugs, especially in the psychiatric drugs. So at this juncture, the home-made preparations like nutmeg tea, yashchi madhu tea, as well as the flax seed, some other herbal preparations are very safe along with the modern psychiatric treatment. Thank you for asking this question, Dr. Gopal.
Thank you.
If there are no further questions, I mean, we are hoping to finish the program at 12 noon. Any other last questions? And then I would like to then get Dr. Rama Jayabala.
One question, please. Last question, maybe to Selvi. Initially, when she was talking about holding anxiety in a body part. What is that exactly? Can she explain it a little bit again? Does the anxiety hold a spot, or is it the body choosing? I didn't understand. How does that work?
So if you are experiencing anxiety, people will hold that tension in some place, and some people will hold it in their shoulders. Some people will hold it, and you sometimes do it without even realizing that it's happening. But people, once you start practicing mindfulness techniques, such as deep breathing, and you become much more aware of your body and where you are holding the tension. And like Dr. Shanmugam was talking about, he was saying how breathing is one of the key techniques to understanding. And people usually are breathing like with their chest, and a lot of that doesn't actually release tension. So you need to do that pushing out of your diaphragm, pushing out of your kind of breathing that really helps with releasing some of the tension. But when you are working with a therapist who's integrative, we work with a lot of where do you hold the tension in your body? And we help people do what they call body scans. And we will basically, it's like you are doing a progressive muscle relaxation, tightening and loosening, and starting to recognize where does my body feel the most tense. And that mindfulness, that awareness comes with that collaboration with the therapist. I hope that answered your question.
Yeah. Thank you so much.
Actually, just a quick comment. Thanks for all the organizers of the Siddha panel. Just one, Dr. Selvashanmugam, I had consulted with him, and then I've been doing the yoga. He's also well-versed with the modern medicine, the Crestor and all those drugs. So it's really comfortable to talk with him, both aspects. And having Dr. Shankari here, it's really building a community, and wish the best for the Manipal, the effort. And for just one, Selvi's the answers to this question, that the releasing the tension. I think the yoga stretchings also releases the tension. When I do the yoga, the next day, the blood glucose level itself is a marked decrease. And if both of you can comment on that, so the integration of psychology counseling along with releasing the stress in a physical muscles and pointing out where it is and releasing it with breathing or yoga. Thank you.
Thank you, everyone. And I'm going to request Rama and Rama to say the closing remarks. I just want to let you know, Rama and Jayabalan, both of them are such sincere volunteer workers and treasurer, and they do a lot of background work. And she prepares all the beautiful flyers, keeps and helps us out. And I'm going to request Rama to do the closing remarks.
Thank you, Shankari, for giving such a beautiful introduction for me. Vanakkam and greetings to everyone. First, I would like to bring to your kind attention about the aim of our GCSMR, bringing Siddha medical knowledge to the fore through advanced research. So as a researcher myself, I really give a lot of emphasis on research and its findings. And I think that's the basic thing that is lacking in Siddha medical system. Why it is not globally accepted is only because it's not known to many of the scientific community. So I'm so happy that GCSMR has taken that first step. And hopefully we will go above and beyond in this field, right? And I would like to thank GCSMR for hosting these great webinars. And I thank all the participants, and please stay tuned for many more to come. And if you have any particular interest that you need us to focus on, please email gcsmr20@gmail.com. And I would, this is a special thanks to Selvi as our second generation person. She's really great. She gave us her insights on coping with pandemic stress. I'm so happy to see our second generation kid pick this field as their career. As you all know, a lot of our kids will go for regular doctor, engineer, and whatnot. But I really appreciate and best wishes for Selvi in her future endeavor. Hoping many more will follow Selvi's path. And I'm sure parents are not yelling at me, oh, why? But I'm sure our kids will do great. And I think the take-home message from Selvi was, please get help when you need it and don't hesitate anymore. And next, I would like to thank Dr. Selva for giving us simple Siddha ways to cope with pandemic stress. He's a great Siddha doctor. And just like I always say, just speaking with him will reduce your stress tremendously, honestly. This is with a lot of experience I'm hearing from friends and myself. I also thank Dr. Shankari for introducing and moderating the webinar in a great way, and we are going to finish it soon. Thank you, Shankari. I would like to extend our thanks to Dr. Swarnam Shankar and Jayanti Shankar for sponsoring this webinar. And thank you, Thamrai and Shanti, especially for sharing your personal experience regarding your COVID infection and how you coped with it and how we came out of it. And I hope we'll get a lot of people sharing your experiences. And last but not least, I am the PR person for GCSMR. And I would like to say something about the donors. Donors are the sole source of success for any nonprofit organization. Without donors, we cannot go anywhere. So I take this time to thank each and everyone who donated for a great cause before, and with a special mention and thanks to Sivasayalam Anna and Dr. Shankari for their generous donation of $5,000, and also extending thanks to our recent donors, Radhakrishnan Kunnat, PK Aravari, Kanchanamma, Selvam Anna and Raji, Sridharan Anna and Radha. And I'm hoping that your support will be continuous with us. And everyone who are here, please consider donating. And like Tamare mentioned, we only have like a week to give the first amount to Manipal University. And as she also mentioned that Manipal University is matching the exact amount that we are giving. So your any little help goes a long way. And thank you all again, and looking forward to meeting you all in future webinars. Thank you very much. And it's a tax, our GCSMR, I forgot to mention, sorry. We are a registered nonprofit tax exempt organization. So your donations will be tax deductible. Thank you very much.
Thank you everyone. Nandri Vanakkam.
Nandri Vanakkam.
Thank you.
வணக்கம் நன்றி.